At the start of this month, we were faced with much uncertainty as our state and most of the nation was experiencing the most significant surge in COVID-19 since the pandemic began. As I stand before you today, I am pleased to say that we're seeing steady signs of improvement, but we still have much work to do to improve our current situation and ensure that we can effectively and responsibly manage it throughout the winter months. During the first week of November, Iowa reported more than 28,000 new cases of COVID-19 and a statewide average positivity rate of nearly 32%. The following week, November 8th through the 14th, new cases rose to nearly 30,000. The positivity rate was just under 29%, and hospitalizations began climbing at an alarming rate. On November 10th and again on the 16th, additional mitigation measures were put in place, including mask requirements indoor public spaces where Iowans couldn't social distance, limiting gatherings to 15 people indoors, restrictions on some organized sports, reducing inpatient elective procedures to ensure that hospital beds were available, and limited hours of operations for bars and restaurants. During the week of November 15th through the 21st, we saw new cases decrease to 24,210, and the positivity rate dropped to 21%, a slight improvement, but still too high, and the number of Iowans hospitalized with COVID-19 peaked at 1,510. Last week, from November 22nd through the 28th, we saw our most significant progress in weeks. More than 14,200 new cases were reported, about half of the previous week's total, and the positivity rate was at 15%, a 6% drop. So even though most testing stopped for the day of Thanksgiving, more than 95,000 Iowans were still tested last week, which is several thousand more than were tested during the first week of November. And further results indicate that the decline in cases and positivity isn't simply because of the holiday. At a local level, many counties are reporting positivity rates over time that are either stabilizing or decreasing. We've also seen the hospitalization rate decrease almost day over day since its peak on November 17th. Equally encouraging, new admissions and ICU utilization are also declining. We continue to monitor this slow, steady progress and remain in close contact with our healthcare partners. Unfortunately, as you are aware of, cases in long-term care facilities are continuing to increase. Routine testing of staff and residents is generating more positive results and putting more facilities in outbreak status. As I mentioned last week, the Department of Public Health and the Department of Inspection and Appeals continue to work closely with these facilities to ensure adequate infection control and other mitigation measures are being taken. Now that Thanksgiving has passed, we're also going to be closely monitoring case counts, positivity rate, and hospitalization over the next 2 weeks for any significant increase. Experience has shown us that holiday events can result in an increase in new cases after family and friends have gathered to celebrate. However, we are cautiously optimistic that the mitigation efforts currently in place are achieving what they are intended to do, and that is decrease the spread of the virus and get it into a more manageable level. These are steps. These are not steps that I take lightly because I understand the impact that they have on Iowans, but I believe they were necessary at the time. We've remained targeted in our approach, and while I didn't close any businesses, the limited hours of operations and the social distancing requirements have had an impact on our hospitality industry through no fault of their own. It's time for Congress to come together and get a relief package passed and get some relief to our small businesses and Iowa families who are suffering.